Professor Jonathan Grant, thank you for joining us today for this Spotlight on COVID video. To begin, please can you tell us about your roles at King's and your interest in the public purpose of universities?
Well, thank you, Nicole. Absolutely delighted to join. My sort of role at King's, I guess you can sort of take back to 1997 when I got my PhD from the Department of Anatomy and Human Biology from King's College London. I have to say I did not enjoy doing a PhD, and I sort of left academia swearing never to return ever again. Back in 2014, King's knocked at my door and asked would I be interested in setting up the Policy Institute. And it seems such a neat idea to try to create a entity that sits at the boundary of a university, and in the case of the Policy Institute, a wider policy community, that I broke that decade or 2-decade long promise and returned to academia, and indeed returned to King's. We set up the Policy Institute. It's still going really strong today, and is seen in the sector as one of the sort of paradigm shifting entities when it comes to looking at policy research and policy analysis. But a couple of years into that role, the principal approached me and asked whether I'd be willing to hold the pen on developing Vision 2029. Obviously, you never say no to the principal, so I agreed to do that. And we started a consultation process across the King's community. We engaged with over 1,000 people over a 6-month period. And what I found really interesting in that process was that the idea of service and the phrase "in service of society" kept on bubbling up in those workshops. And for me, that was almost the beginning of a process, an intellectual sort of conversation I had with myself about, well, what is actually the role of universities in the 21st century? And as you know, we decided to put service alongside education and research as part of our academic mission, playing out in the context of London and playing out internationally. And that's quite unique. If you look across the UK sector, the only other university which has effectively done that is Manchester, and they call it social responsibility. So I'm absolutely delighted that both we heard that desire to be in service of society, and we've sort of incorporated it and hardwired it into the vision and now structures of King's.
Thank you, Jonathan. And I know you're working on a book at the moment about, in relation to your role as Vice Principal for Service at King's and the public purpose of universities. And I think that's particularly relevant at the moment, this discussion around the public purpose of universities, because we've seen from the outbreak of the COVID-19 crisis that universities have contributed to the global response in a variety of ways. And in light of these contributions, how do you think the pandemic will impact on the public purpose and perception of universities?
Yes, and you're right, Nicole. I am writing a book called The New Power University, which will be published early next year. And in that book, I explore sort of two themes. One is the theme of the mission of the institution, the mission of the university, where I very much take that argument we picked up in the consultations around Vision 2029 and say that social responsibility has to be part of that core mission going forward. And then the other element is actually how we behave. What's our institutional being? What are our institutional values? And I argue quite strongly that we need to move away from the managerialism that has defined the last 20 years of university life to a set of values sort of embraced around this concept of new power, which is around social movements being connected through social media. And I think in one sense, we've seen a lot of that start to play out in the COVID response by universities at King's and actually right across the sector. So on the sort of education side, we have seen a pivot to online education in a way that probably wasn't anticipatable 6-12 months ago. Now, I'm not saying that we should continue to be delivering all our education online. I absolutely respect the idea that part of the education experience needs to be done face-to-face in a classroom. But we do have to remember that the sort of Gen Z students that are coming to King's and other universities are digital natives, and they are very, very comfortable with online education. So we've seen that shift. If we look at the research endeavour, there's some amazing projects out there. The project which I sort of engage with every day is the COVID-19 app, developed by Tim Spector and colleagues, where you put in your symptoms every day and that data is analysed on a daily basis. There are 3.5 million people in the UK who are contributing their data to that app. And if you look at it and you look at their website, you can cut the data in many, many different ways. And one of the most interesting bits is actually looking at the hotspot data. So I live in Cambridge, and I'm always like looking to see what's happening in Cambridge. And thankfully, so far, not much. And then on the service side, a beautiful example is Lifelines, developed by Louise Rose and Joel Meyer of King's Health Partners. And there's such a simple idea of donating tablets and letting patients who are hospitalized and isolated from their families with COVID engage with their families back in their home. So we see, that's a really good new power example, because we see the value of technology and we see the value of a social movement being created by practitioners who saw the demands and need and stepped up to the plate to make that happen. And their data, they have connected 25,000 individuals with their families over this period, individual calls rather than individuals. So that's absolutely extraordinary.
There's some really brilliant examples that you've given there, Jonathan. And as you say, it's not just King's that are contributing in this way, it's universities across the world even. And we've also seen some really brilliant collaborations between universities. And in light of these examples, do you think that the COVID-19 pandemic has spurred on some of the changes that you expected or perhaps hoped would occur in relation to the public purpose of universities?
Very much so, and I think it's worth just thinking about what we mean by a university in this context, because when we say the word university, we think of a sort of grand institution. I think of the King's Building, which is old power through and through, but actually a university is a community. And when we look at the examples in response to COVID, we've had examples from our staff, academic professional services, we've had extraordinary examples from our student population, and likewise from our alumni population. So I'm very keen that when we talk about universities, we're talking about that extended community, that extended family, if you like. But I do think, Nicole, you're right. I think in one sense, a lot of the ideas I've put forward in the book and have been sort of arguing with you and colleagues for a number of years now have been, if you like, accelerated and amplified by the pandemic. Now, nobody would wish the pandemic on anyone. And, I'm not saying in any sense the pandemic has helped us make this case, but it does seem to me that the idea that we do need to use this moment to reset, if you like, the social contract between universities and society and sort of reinvigorate that license to operate is an opportunity we have now, which we probably did not have 12 months ago. And it's very easy to forget when we sit inside our institutions, inside our communities, how we are perceived by the political class, if you like, and the public. And I have a lovely slide which I've collected over the years of tabloid headlines criticizing universities for all the ills, if you like, in the world. And we have to break that dynamic. And I think we can break that dynamic because actually, when push came to shove, the universities and the communities of universities were some of the only civic institutions which were in that space and willing and able to step in that space and support the health service in a broader sense and the wider population as we have navigated this horrendous pandemic.
Thank you, Jonathan, and thank you especially for your time today. And I can't wait to read your book.
Okay, thank you very much, Nicole.